Hello friends, I'm Shubham. Welcome to my YouTube channel. In this video, I will teach you about the osteology and basic anatomy of the head region. So let's start. The head. The head is composed of a series of compartments which are formed by bone and soft tissues. These compartments are the cranial cavity, ears that are two in number, two orbits, two nasal cavities, and one oral cavity. Cranial cavity is the largest compartment and it contains brain and associated membranes that are the meninges. Now we will discuss about the component parts. Skull, it is the skeleton of the head. It is formed by many bones that are interconnected by sutures. In case of adult skull, it consists of 22 bones. Remember, 22 bones. In many books it is written that it is composed of 28 bones, but if we are excluding the ossicles of the ear, then there are 22 bones. Now, except for the mandible that forms the lower jaw, the bones of skull are attached to each other by sutures, and these are immobile and form the cranium. Further, cranium is subdivided into calvaria. It is the upper domed part that covers the cranial cavity containing the brain. A base that consists of the floor of cranial cavity and a lower anterior part, the facial skeleton. It is also called as viscerocranium. Now, out of these 22 bones, some are paired and some are unpaired. Now, the bones forming the calvaria, those are in pair are the parietal and temporal bone, and those unpaired are frontal, occipital, sphenoid, and ethmoid bone. Bones forming the facial skeleton, those in pair are the maxilla, zygomatic, nasal, lacrimal, palatine, and inferior nasal concha, and a single unpaired bone, vomer. In some books, it is written that mandible is also a part of facial skeleton, but no. Mandible is not a part of cranium nor part of the facial skeleton. It is a separate bone of the skull. Okay. Now we will read about the skull in different views. First is the anterior view. That is when we are seeing the skull from the anterior aspect. Okay. The anterior view of the skull, it includes the forehead superiorly. I will use the terms superior, inferior, lateral, medial. Okay, so forehead at the top, and at the lower part, that is the inferior part, the orbits, the nasal region, the part of the face between the orbit and the upper jaw and the lower jaw. I have drawn just a schematic diagram of the anterior view of the skull. So here we can see the frontal bone, maxilla, zygomatic bone, mandible, nasal bones, and various structures that I have labeled here. So again, coming to the point, in the anterior view at the superior part we have the forehead, and forehead consists of the frontal bone. See in the diagram, frontal bone also forms the superior part of the rim of each orbit. Now, just superior to the rim of orbit on each side are the raised superciliary arches. We can see here the superciliary arches, and these are more prominent in men than in women. And between these arches is a small depression that we call glabella. If we will look at the medial part of the superior rim of each orbit, we can find that there is a notch or foramen. This is called a supraorbital foramen or supraorbital notch. Going to more medially, the frontal bone projects inferiorly and forms a part of medial rim of the orbit. Laterally, zygomatic process It is a zygomatic process of the frontal bone that projects inferiorly, forming the upper lateral rim of the orbit. And this process articulates with the frontal process of the zygomatic bone. I have written in the notes the main points that you should remember about. These are superciliary arches, glabella, supraorbital notch or foramen, zygomatic process of frontal bone, and frontal process of zygomatic bone. These are the main parts. The second bone is the zygomatic and the nasal bones. So zygomatic bone is also called cheek bone. The prominence of the cheek is due to these bones, zygomatic bones. The lower lateral rim of the orbit, as well as the lateral part of the inferior rim, is formed by zygomatic bone. At the superior end, in the nasal region, there are paired nasal bones. One nasal bone on each side articulate with each other in the midline and with the frontal bone superiorly. The center of frontonasal suture formed by the articulation of nasal bones. These are nasal bones and the frontal bone. Here is the center point. This is called nasion. Laterally, each nasal bone articulates with the frontal process of each maxilla. Okay. Now, inferiorly, there is a pyriform aperture. See in the diagram, this part is called pyriform aperture. Pyriform aperture is just a large opening in the nasal region and the entire opening of nasal cavity. It is bounded superiorly by the nasal bones and laterally and inferiorly by each maxilla. Okay. Now we can view some structures through the pyriform aperture. These are the fused nasal crest that forms the lower part of bony nasal septum. When I will discuss about the nasal anatomy, nasal regions, the nasal septum, then I will tell about the nasal septum. Okay. And these nasal crest, they end anteriorly as the anterior nasal spine and the paired inferior nasal concha. Now comes to maxilla. There are two maxilla on each side, they fuse. Now this is the part of the face between the orbit and upper teeth, and each upper jaw is formed by the paired maxilla. So at the superior end, each maxilla contributes to the inferior and medial rims of the orbit. Laterally, the zygomatic process of each maxilla articulates with the zygomatic bone, and medially, the frontal process of each maxilla articulates with the frontal bone. Simple. And inferiorly, the part of each maxilla that is lateral to the opening of nasal cavity, it is called body of maxilla. And on the anterior surface of body of maxilla, we can see here there is two foramens. These are called infraorbital foramen. These are present just below the inferior rim of the orbit. Another structure that we can see is the alveolar process. It contains the teeth and forms the upper jaw. At last we comes to the mandible. It forms the lower jaw and it is the most inferior structure in the anterior view of the skull. It consists of the body of mandible that is present anteriorly and the ramus of mandible that is present posteriorly. Now these two parts of the mandible, they meet at the angle of mandible. All these parts of mandible are visible to some extent in the anterior view. I will discuss about these individual bones later on next videos. So here, for a brief introduction, I have just mentioned the parts of the bones. Okay. Body of mandible is again divided into two parts. The lower part is called the base of the mandible and the upper part is the alveolar part of the mandible. Alveolar part of mandible Nothing, just contains the teeth and is resorbed when the teeth are removed. The base of mandible has a midline swelling. See here, there is a midline swelling. They are called mental protuberance. Now just moving lateral to mental protuberance on either side are slightly more pronounced bumps. They are called mental tubercles. Moving more laterally, you will find a mental foramen that is visible halfway between the upper border of alveolar part of the mandible and the lower border of base of mandible. And if we continue past this foramen, we will find a ridge. This is called oblique line that passes from the front of ramus onto the body of mandible. Now this oblique line is important because it is a point of attachment for the muscles that depress lower lip. And this is all about the anterior view. Now we come to the lateral view of the skull. I have just drawn with different colors to just differentiate different bones. There is a frontal bone. These are the parietal bones. These are maxilla, zygomatic, nasal bones, occipital bones, temporal bones. Okay, so in the lateral view of the skull, that consists of lateral wall of cranium. Lateral wall of cranium includes lateral portion of the calvaria and facial skeleton and also half of lower jaw. Now what are the bones that form these components of lateral wall of cranium? The bones that form the lateral portion of calvaria, they include frontal bone, parietal bone, occipital bone, sphenoid bone, and the temporal bone. The bones that form the visible part of facial skeleton. Note here the visible part, not that part that is not visible virtually, because it is a 3D structure. Some parts of bone may not be visible in the lateral aspect. So whichever is the visible part of the facial skeleton here, it includes the nasal, maxilla and zygomatic bones. And mandible, it forms the visible part of lower jaw. So whatever the lateral portion of calvaria, there are some important points that I have written here. These are the coronal sutures, lambdoid suture, sphenoparietal suture, sphenosquamous suture. Now when we come to the lateral portion of calvaria, it begins anteriorly with the frontal bone. Okay, see here, it has begun with the frontal bone anteriorly. In the upper regions, the frontal bone articulates with the parietal bone at the coronal suture, and the parietal bone then articulates with the occipital bone at the lambdoid suture. In the lower parts of the lateral portion of calvaria, the frontal bone articulates with the greater wing of sphenoid bone, which then articulates with the parietal bone at the sphenoparietal suture. Okay, see here, this is the sphenoparietal suture, and the sphenoid bone then also articulate with the anterior edge of temporal bone at the sphenosquamous suture. These are the sphenosquamous suture. A term called pterion. What is it? It is the junction where the frontal, parietal, sphenoid and temporal bones are in close proximity. So what is its clinical importance? The clinical consequences of a skull fracture lies here. What is it? Because skull fracture in this area can be very serious. Why? Because bone in this area is particularly thin and just overlies the anterior division of middle meningeal artery, which can be torn by a skull fracture in this area that may result in extradural hematoma. At last we will see here articulation that is across the lower part of lateral portion of calvaria, and it is between temporal bone and occipital bone at the occipitomastoid suture. Another bone in the lateral part of the skull is a temporal bone. It is a major contributor to the lower portion of lateral wall of cranium. Okay, it consists of several parts. I've just mentioned about the parts that are the squamous part of temporal bone, zygomatic process, tympanic part of temporal bone, and petromastoid part. Here I must mention some little details about these parts. So first comes the squamous part. Why it is called squamous? Because it has appearance of a large flat plate and it forms the anterior and superior part of the temporal bone. It articulates anteriorly with the greater wing of the sphenoid at the sphenosquamous suture and also with the parietal bone superiorly at the squamous suture. Second is the zygomatic process. What is it? It is an anterior bony projection from the lower surface of squamous part of temporal bone that initially projects laterally and then curves anteriorly to articulate with the temporal process of zygomatic bone. See here, it has been articulated here, and this articulation forms the zygomatic arch. Now immediately below the origin of zygomatic process from the squamous part of temporal bone is the tympanic part. We can see clearly on the surface of this part of temporal bone there is a external acoustic opening, and it ultimately leads to the external acoustic meatus, that is the ear canal. And last not the least, there is a petromastoid part. We can divide it in the petrous part and mastoid part. Mastoid part is the most posterior part of temporal bone. See, it is important. It is the only part of petromastoid part of temporal bone that is seen on a lateral view of skull. Mastoid part is continuous with the squamous part of temporal bone anteriorly and articulates with the parietal bone superiorly at the parieto-mastoid suture, and also with the occipital bone posteriorly at the occipito-mastoid suture. These sutures are continuous with each other, and the parieto-mastoid suture is continuous with the squamous suture. If we go inferiorly, we can find a large bony prominence that is projecting from the inferior border of mastoid part of temporal bone. See here, this is called mastoid process, and this is a point for attachment of several muscles. Medial to mastoid process, we have the styloid process that projects from the lower border of temporal bone. Now I will discuss about the bones that are forming the visible part of facial skeleton. These are the bones of viscerocranium that are visible in the lateral view of the skull, and these are a nasal bone anteriorly, the maxilla with its alveolar process containing teeth forming the upper jaw, and anteriorly it articulates with the nasal bone. Superiorly it contributes to formation of inferior and medial borders of orbit. Medially its frontal process articulate with the frontal bone, and laterally its zygomatic process articulate with the zygomatic bone. Third is the zygomatic bone, and we know it forms the prominence of the cheek. Now medially it assists in the formation of the inferior rim of orbit through its articulation with the zygomatic process of maxilla. Superiorly its frontal process articulates with the zygomatic process of frontal bone and assists in the formation of lateral rim of orbit. And laterally the temporal process of zygomatic bone, that is horizontal, it projects backward to articulate with the zygomatic process of temporal bone and so form the zygomatic arch that I have discussed earlier. There is usually a small foramen that is called zygomaticofacial foramen that is visible on the lateral surface of zygomatic bone, and another foramen that is called a zygomaticotemporal foramen is present on the medial deep surface of bone. At last, the mandible that forms visible part of lower jaw. In the lateral view of the skull, anterior body of mandible, a posterior ramus of mandible, and the angle of mandible, where the inferior margin of mandible meets the posterior margin of ramus. Clear? Teeth that will be lodged in the alveolar part of body of mandible, and the mental protuberance is visible in this view. Again, a mental foramen that is on the lateral surface of body and on the superior part of ramus. We can appreciate two processes that are called condylar process and coronoid process. that ultimately extend upward. The condylar process is involved in the articulation of mandible with the temporal bone, and the coronoid process is the point of attachment for the temporalis muscle. At last, I want to discuss about some important foramens that will be visible in the anterior and lateral view. In the anterior view, we have three foramens. These are supraorbital foramen, infraorbital foramen, and mental foramen. Now the question lies here, what are the structures that are passing through these foramen? So answer is, through the supraorbital foramen passes supraorbital nerve and vessels. Vessels means both artery and vein. Through the infraorbital foramen passes infraorbital nerve and vessels, and through the mental foramen passes mental nerve and vessels. Very simple. In the lateral view, we have the zygomaticofacial foramen. Through these passes zygomaticofacial nerve. So that was all about the skull basic osteology and the original anatomy, and just we have discussed about anterior and lateral view, and that's all. And I will discuss about the posterior and the inferior view in the next video. So thank you for watching the video.